Um, Here we have a 22-year-old male patient. As we can see in the picture, the tongue is pale red with slightly swollen sides. In Chinese diagnosis, this indicates clinch deficiency with accumulation of dampness. We can also see small cracks at the center of the tongue, a dry center without coating, which indicates the onset of stomach-kin deficiency. You can also see a yellow thin coating at the posterior third, indicating slight retention of damp heat in the lower burner. As for the symptoms, the patient has severe itching of the skin, damp red skin lesions, no appetite, a feeling of fullness after eating, soft smelly stools, night sweats, inner restlessness, and depressive mood. As for the Western diagnosis, it's atopic eczema. The background to the disease, the patient has a family history of eczema, alcohol and caffeine abuse, and a long-standing emotional problems. Okay. So next case, we have here a 37-year-old male patient. We can see a red, wide, and thin tongue, which means there is already an injury to the fluids due to heat. You can also see a peeled red crack center, indicating there's stomach-kin deficiency with heat in the stomach. You can also see curled up, slightly swollen edges, indicating liver qi constraint with heat in the liver. There's also a reddish curled down tip, indicating heat from deficiency in the heart. And finally, there's a yellow, slightly thick coating with red points at the root, indicating accumulation of damp heat in the large intestine. As for the symptoms, the patient has constant headache, migraine, inner restlessness, occasional stomach pains, and smelly loose stools. So there is no Western diagnosis as to the background of the disease. The patient has suffered from trauma, a fracture of the skull, 2 years before this picture was taken. There was also alcohol abuse in the past, an excessive consumption of spicy food, and also emotional problems. Next patient, we have here a female, 39 years old. The tongue is reddish, which means there's slight heat in the blood. You can also see a deep crack in the center, indicating stomach-kin deficiency. The tongue is also has also a peeled coating at the root, indicating kidney-yin deficiency. You can also see that there is a curled up and slightly red edges, indicating liver qi constraint with heat in the liver, and finally a red tip, indicating heat in the heart. As for the symptoms, the patient suffers from red, itchy, dry skin at the neck and face. There's also sensations of heat in the body, depression, and occasional feeling of tightness in the chest. So for the Western diagnosis, the patient was diagnosed with atopic eczema, allergic rhinitis, and allergic asthma. Background to the disease, the patient has weak constitution, repressed emotions, and unhappy marriage. Okay. Here we have a case history. Mrs. S suffered from atopic eczema since the age of 25. Whenever she encountered emotional difficult situations, her skin immediately turned red and dry and became very itchy. Her skin was particularly red around the neck and face, and for many years she used large amount of cortisone creams to improve the appearance of her skin. In addition, her marriage proved to be a great strain on her as her husband became mentally ill. She was very anxious and fearful and unable to express her frustration and anger. In general, she felt very unhappy and experienced times of deep depression. As a child, she experienced frequent asthmatic attacks and acute bouts of allergic rhinitis, but they rarely manifested in adulthood. The reddish tongue showed a very deep crack in the center, and the tip was very red. Her pulse was very rapid, thin, and slightly wiry. As for the analysis to her condition, the energetic condition of this patient can be characterized by a deep constraint of liver qi with development of heat. The curled up and slightly red tongue edges confirm this diagnosis. They often appear when long-standing emotional problems cannot be resolved. Here, heat in the blood is mainly responsible for the condition of her skin. Over many years, the blood and fluids in the relatively superficial layers of the body were injured by heat, which manifested as dry red skin. This woman was always sick as a child and had a weak constitution. This, together with the application of cortisone creams for well over 20 years, were the main factors underlying the weakening of the stomach and kidney yin. The rootless coating of the tongue is an important indication of the deficiency. The deep crack in the center reflects stomach yin deficiency. The kidney yin deficiency and internally generated heat disturb the organ's harmonious communication with the heart, manifested in anxiety and depressive states. Finally, the rapid and thin pulse denotes heat from deficiency due to a lack of yin, and its wiry quality suggests the presence of liver qi constraint. So, for the normal tongue coating, the center should be moist and show a thin coating. In the case of stomach yin deficiency, cracks or dryness will appear in this area. An improper diet, as well as eating in a hurry, too late, or irregularly may be important factors in the development of this deficiency. If the tongue body color is pale or pale red, the stomach yin can be regenerated within weeks or months, provided the diet has been rectified. However, if these tongue signs appear with red tongue body, it is indicative of stomach and kidney yin deficiency, suggesting that the healing process will take longer. Okay. So here we have another patient, a female, 54 years old. The tongue is pale red and swollen. So in TCM diagnosis, it's spleen chi deficiency with accumulation of dampness. We can also see a thick greasy coating on the left side, indicating accumulation of damp heat in the liver and the gallbladder. You can also see coating without root, which indicates stomach yin deficiency. There's also a deep crack in the center with yellow greasy coating, indicating stomach yin deficiency with accumulation of phlegm fire in the stomach. As for the symptoms, the patient experiences loss of hearing in the left ear, panic attacks, inner restlessness and nervousness, There's also dizziness in the morning, headaches, insomnia, and occasional night sweats. In Western diagnosis, the patient is diagnosed as having acute loss of hearing. As to the background to the disease, there's excessive demands at work and emotional problems. Okay. Next, we have here a male 66-year-old patient who has red firm tongue shape, indicating a kidney yin deficiency. The coating is without root, especially at the center and the root of the tongue, indicating stomach and kidney yin deficiency. There's also a yellow old coating indicating accumulation of damp heat in the large intestine. As for the symptoms, the patient suffers from severe constipation, heartburn, stomach pains, extreme physical weakness, there's night sweats, and pain in the bones. As for the Western diagnosis, this patient has prostate cancer with metastasis to the bones. Background to the disease, the patient is overworked and has emotional problems. So the patient died 3 months after the photo was taken. So we discuss further the completely cracked tongue. This is a unique type of tongue, which is this completely cracked tongue. You can see deep, wide cracks always located at the edges and sides of the tongue are a distinctive feature of this completely cracked tongue body. Despite its startling appearance, no particular disharmony or pattern of disease is associated with this type of tongue, and it often occurs in more than one family member. Nevertheless, the cracked tongue may point to a constitutional weakness and deficiency of fluids and kidney yin. These tongues are usually big and swollen. It is therefore important to check the tongue body color. If it is pale, it is indicative of deficiency of blood and fluids. If it is red and completely cracked, it indicates deficiency of the yin and fluids. As a rule, this type of tongue has very little coating or no coating at all, which can be explained by the lack of fluids in general. However, it bears repeating that a person with this type of tongue does not necessarily have any serious or organic illness. Here are examples of another person with a cracked tongue. This patient is 42 years old, male. Tongue color is pale red with reddish patches. In Chinese diagnosis, this means blood deficiency with heat developing. There's also thin vertical crack with horizontal cracks, indicating slight stomach yin deficiency. There are also deep cracks at the side of the tongue, indicating spleen qi deficiency with the onset of spleen yin deficiency. And the reddish tip indicates heat in the heart. For the symptoms, the patient has foul-smelling diarrhea, flatulence, a plump pit filling in the throat, a burning of the tongue, and tiredness. There is no Western diagnosis. Background to the disease, the patient is overworked, has emotional problems, and has constitutional weakness. Next case is a female, 35 years old. The tongue is pale red with cracks over the entire surface with notches and cracks at the side. This indicates constitutional weakness of qi, blood, yin, and fluids. The yellow and thin coating at the center of the tongue indicates retention of damp heat in the stomach. As for the symptoms, the patient has stomach pains, heartburn, vomiting with excitement, and feelings of fear. There is no Western diagnosis. Background to disease, the patient is overworked, has emotional problems, and has constitutional weakness. Okay. Another patient, 42 years old female. The tongue is reddish with cracks over the entire surface, with notches and cracks at the sides. The Chinese diagnosis here is constitutional weakness of qi, blood, yin, and fluids. There's white thin coating at the center of the tongue. This is a normal tongue coating. As for the symptoms, the patient has depressive moods, inner restlessness, cough with scanty mucus, hoarseness, and joint pains. As for the Western diagnosis, the patient has chronic inflammation of the vocal cords. Background to disease, the patient overuse her voice, has irregular eating habits, has emotional problems, and also constitutional weakness. Okay. Finally, among the examples of cracked tongue, here we have a male 46 years old patient. The tongue is red, indicating kidney yin deficiency. The reddish tip indicates heat in the heart. We can also see a deep vertical crack in the center of the tongue, indicating their stomach deficiency and deficiency of fluids. There's notches and cracks at the sides, also indicating deficiency of fluids and yin. The tongue has no coating. This means a stomach yin deficiency. As for the symptoms, the patient suffers from impotence, difficulty urinating, and dribbling urination. Also suffers from depressive moods, irritability, and heartburn. As for the Western diagnosis, the patient has hypertrophy of the prostate. Background to the disease, this patient has emotional problems and a constitutional weakness. These caps are examples of cracked tongue. Thank you for listening.